Thanks for staying with us. Now, in the past 24 hours, South Africa has recorded 4,230 new COVID-19 infections. This is among the highest numbers recorded in recent days, reflecting an increase of about 16.8% positivity rate. Meanwhile, 2 people succumbed to the virus, bringing the total fatalities since early 2020 to just over 100,000. Analysts have warned that this could mean a possible 5th wave of infections in the country by the end of this month or the beginning of May. For more on this, I'm joined by Professor Adrian Puren, Executive Director at the National Institute for Communicable Diseases. Professor, very good evening to you. Thank you for your time. A jump in the number of positive COVID-19 cases. Does this now raise concerns of the possibility of a 5th wave?
It just heightens the alert that we are probably moving towards a 5th resurgence. Certainly the positivity rate has certainly increased, but I think the 7-day moving average, although not dramatically changing, is certainly on the increases as well. So I think we are heading towards that direction. But it's very difficult to predict what's going to happen over the next few days and few weeks. But so it's really critical that we keep an eye out, not just simply on the positivity rate, because again, we don't know how people are presenting themselves for testing. I think what is going to be critical as well is really then to keep an eye on what's happening with regard to hospitalization, severity of disease, ICU capacity and oxygen utilization, for example, and deaths as well. So thus far, although the trajectory is on an upward trajectory, the overall picture, at least with regard to hospitalizations and deaths, is really, and though there are nuances, but it certainly overall is really flat at this particular time. It's not great, obviously, for people to end up in hospital and die, but nevertheless, at this time, there's no evidence of being overwhelmed at the hospitals.
And as you speak about perhaps some of the matters to note with importance, we know that Health Minister Dr. Joe Phaahla has said that more time will be needed to perhaps determine the trend of this wave. But what are you noting when it comes to patterns that may be emerging, especially as we head into the colder months of winter?
Yes, obviously with the colder months, there's going to be greater congregation of people in enclosed spaces. So again, it's really important to look at ventilation, look at how people monitor their risks, especially the wearing of masks, especially in workplaces and at homes, for example. Those are going to be key things that has to be monitored, or at least give us some idea what's actually happening. I think really critically is that we certainly, as we've seen for the 4th resurgence, we certainly saw the Omicron virus uncoupling or decoupling, as it's called as well, between the number of cases. So although you can certainly see that now for Gauteng and KwaZulu-Natal, there's an obvious upward inflection of the numbers of cases. But as I said to you, it's very often difficult to tell the testing patterns, but it still gives us an idea about the trends. I think what is going to be more critical is really the trends around hospitalizations, deaths, ICU capacity and oxygen utilization. I think those are going to be really the key indicators that we will monitor. I think the other monitoring tool that we do have, at least 2 of them, are really what is in circulation in terms of the variants. So thus far, the Omicron variant, which was seen in the 4th resurgence, is certainly still the major variant in circulation, but there may well be subvariants of that which may be contributing to what we are currently seeing. The other key way in which we could certainly monitor is really the wastewater, and that too by triangulating, and we've certainly seen an increase in terms of the detection of COVID virus, or at least the RNA in fragments in terms of the wastewater, certainly also indicating that there are an increasing numbers of cases. So I think triangulating these pieces of information will certainly give us an idea what the likely trajectory will be. But again, it comes back to the fact that we need to ensure that those non-pharmaceutical interventions, such as the wearing of masks, I think that's going to be critical, as well as managing indoor facilities, again, around ventilation. And of course, really key is really vaccination. I think that's really going to be, again, I know that it's really been difficult as the South African community to get to the high vaccine coverage rates that we're expecting. But again, I really would like to encourage people, especially in the older age groups, especially those with comorbidities, to really get vaccinated. And as you know, flu's coming along as well. So, these things can complicate our lives.
Yeah, absolutely. Could we possibly read the pattern in comparison to what we're seeing in the US, in the UK, in China, in terms of how the virus is progressing in those countries?
I think it's difficult. There are different nuances. For example, in South Africa, we've had a high rate of natural exposure to infections, and combined with vaccination, I think it's certainly given us a very different picture in terms of the uncoupling that we saw in the fourth resurgence. So it's really difficult to compare that to the UK and the US. Although, again, those are warning signs, again, that if you do have a system that gets overwhelmed, that you can be in trouble. So it's really key, I think, for provinces to really be prepared, as always, to be able to cope with hospitalizations, ICU capacity, and oxygen supply. I think there are more sophisticated tools that South Africa is currently using to monitor those. I think that's going to be certainly very useful. And I think comparison to China, I think, is very difficult because, or very different, in the sense that China really had a severe lockdown. The vaccines that they were utilizing, I understand, did not have in terms of the efficacy, did not have the same extent of the efficacy, and that became problematic, as well as the fact, and similarly to South Africa, we're not vaccinating our older age groups, and that's where the problems certainly start as well. So I think we can certainly look to that and learn from it and apply it to South Africa, but there are some nuances and differences.
Government announced a relaxation of some of the COVID-19 measures when it comes to mask wearing, for instance. Could we now see ourselves in a position where that may need to now be reversed, where we need to relook the wearing of masks, just gauging the acceleration of cases we're noting?
There may be some subtle nuances, but I think that, at least for the indoors, I think, and in specific settings, I think mask wearing is still required. So yes, there may be greater emphasis, for example, especially in outdoor settings, for example, again, if there's going to be congregant events and size of events, again, those can certainly be considered, and again, advice be given. So I think it's really monitoring those particular numbers and monitoring where you are to really gauge risk and decide about mask wearing. But I'm sure there'll be overall guidance around that, as you've certainly, I'm sure, seen, at least in the workplace. I think the guidance is pretty clear around, for example, mask wearing, ventilation, spaces between individuals. So those are certainly clear, and I think those will certainly be in place, and I don't think that those will be markedly changed. There may be nuances, certainly.
Very well. Thank you so much for weighing in on that discussion. That was NICD Executive Director, Professor Adrian Puren, speaking to some of the numbers, COVID-19 numbers on the rise, and some factors to consider there.